Do I need HCG on testosterone replacement therapy? A very common question.
This is the TRT and Hormone Optimization YouTube channel. And if you want to learn all about the science-based information on this topic, consider subscribing, hit that notification bell, and you'll be on your way.
Welcome everyone to the video. This is the TRT and Hormone Optimization YouTube channel. As a guest, we have back here Gil T. Welcome, Gil.
Hey, Stephen. Always good to be here with you. Thank you.
Hi, thanks for being here. So, do I need HCG on testosterone replacement therapy? A very common question.
Well, do you need it? The short answer would be no, you do not need it. Do you want to add that into your protocol? That is a second question that we can answer a little more in detail. And the answer to that, it really is going to depend on the individual, their goals, their needs, their desires, and what the prognosis is for achieving what HCG is designed to do. And that's going to be determined by their initial diagnosis of why they were put on TRT in the first place. So as you know, we've done a video in the past on the different types of hypogonadism or states of low testosterone, the causes behind them, and how guys come into a position of getting there in the first place from a biological standpoint. So if you were diagnosed with primary hypogonadism or a strong case of primary hypogonadism, where your luteinizing hormone levels are sufficient or even super physiological, meaning above range, yet you still have low testosterone, this would be a case where your testicular function has failed. This is also called testicular hypofunction, also known as primary hypogonadism. And when your testicles no longer produce sufficient levels of testosterone, it is very, very important that you go and you get a semen analysis done prior to beginning TRT if you have fertility concerns, to establish what your baseline fertility potential is before starting treatment. Because as we know, when you suppress endogenous testosterone levels via the use of exogenous hormones on TRT, you are, in a sense, and this isn't always the case, but you know, biologically this makes sense, you are suppressing your own fertility by removing the amount of endogenous estrogen conversion and endogenous testosterone production within the testicles, which, as we know, is essential for the Sertoli cells to produce sperm. So when spermatogenesis happens to decline as a result of time under treatment with exogenous use of testosterone, we generally see men become less and less fertile. And I say this cautiously because I don't like to use the word infertile, because that would suggest flat out sterility. And that is not the case. We know that many guys come in with the misconception of testosterone therapy is going to make me infertile or sterile. And that is a safe means of birth control. And it certainly is not. So you still should take any precaution to prevent any unexpected or unwanted pregnancies while using testosterone therapy. With all of that said, HCG is designed primarily to preserve, by the mechanism of action, it mimics luteinizing hormone, which preserves some level of endogenous testosterone productions within the latex cells or interstitial cells of the testes. And therefore, this can aid in spermatogenesis to occur within the testicles in the Sertoli cells. Now, there's no guarantee it'll happen, especially if you were already lacking fertility due to a chronic case of hypogonadism that went untreated for a long period of time, or if you had any sort of undescended testicles or any sort of testicular cancer or any history of infertility prior to that. So this is why HCG is not a surefire way of ensuring fertility. Now, we know that luteinizing hormone stimulates testosterone production. We know that follicle stimulating hormone, also secreted by the anterior pituitary, promotes spermatogenesis. We also know that the two combined work significantly better for fertility. So as we mentioned in another video several months back, the use of HCG or LH mimickers combined with FSH or FSH mimickers is going to give you a better fighting chance for fertility. With that said, there's nothing wrong with maintaining testicular function on a slow drip throughout your TRT journey. And if you reach a point in time where you do wish to conceive, you can always go in and add in ancillary FSH analogs in order to complement the attempt. With all of that said, again, no, you do not need HCG. There may be times and circumstances where you should use HCG, and this is why it is not a clear-cut answer. It is more independent on the individual circumstance, and diagnosis. And if you have a competent provider who understands all of this stuff, they should be able to advise you properly. If you do not, you could always reach out here and we will be happy to try to guide you along the best we can.
If you're older like us and you already have enough children, you're not interested in conceiving anymore, do most guys have any benefit on taking it at that moment?
Before we continue, if you appreciate the content we bring to this channel, check out the Amazon links in the description of this video. These are the links to the products we use, going from supplements, protein powder, pre, post, intra-workout, anti-aging cream, sunscreen, needles and syringes to inject, and so on. If you'd like to purchase one of those products, please use the direct link so that it will earn us a few cents as a tip, and you'll be guided directly to the products we recommend. Thanks in advance.
All links should work on the US, Canadian, and UK Amazon stores.
Okay, so this I would like to answer in 2 points. The first point is going to be more of a social response, and the second one is going to be more of a medical response. The social response is going to be such that I have with patients all the time in our clinics. And this is, guys come in and say, I have 2 children, 3 children, etc. I'm married, I'm 45, I'm done. Unless they have had a vasectomy, which medically makes it impossible to get pregnant, I always pose a question of what happens if tomorrow you were to go your separate ways and you met a younger partner who has no children and they wish to have children with you. This is not something you can fathom today. However, it is a realistic thing that we see on a constant basis. And do you really want to have that conversation of saying, I cannot, and possibly risk losing that new relationship? Or do you want to leave that option open for the future and not make a decision today that is permanent based on your current situation? Because life throws curveballs and things change all the time. Perhaps you may want to change your mind at some point in the future. So I always recommend leaving the door open, and you can always refrain from conceiving in the future if you'd wish. But to go ahead and say today I will never is kind of a dangerous standpoint. So that is just a little social sidekick for guys to keep in the back of their mind. From a medical standpoint, the question is, I'm sorry, and if you would just repeat the guys that have children already.
If there would be any benefit taking it anyway.
Yes. Outside of fertility, you got to understand the secondary or side effect, so to speak. Side effect is a negative term. So maybe intended effect or secondary effect of the mechanism of action. So HCG by definition is an LH mimicker in men because it is a female pregnancy hormone derived from pregnant female urine. And then in men, it acts as an LH mimicker. What this does is it actually stimulates production of testosterone within the testicles. This will prevent testicular atrophy. We know this. Not all men receive or experience testicular atrophy on TRT, but those that do, this can prevent and very efficiently and rapidly reverse an existing state of testicular atrophy, depending on how long they've been suppressed. This can have a cosmetic effect and a psychological effect that is positive. The anecdotal things that we have seen in clinics and with patients that is not necessarily medically documented or studied, but we have seen it firsthand, is increase in sensitivity, an increase in libido, and a possible increase in ejaculate volume as a result of endogenous stimulation. All of these, again, I don't have studies to show for them, and maybe there are some, but I haven't seen any. But these are things that have been reported anecdotally by patients over and over and over and over again. So when you look at case studies that become repetitive, you have to take that as something in the real world and present it to people and let them draw their own conclusions. So you can benefit from HCG use in other senses, like I just mentioned, outside of just a fertility prospect.
And are there any side effects to mention? Could they do that indefinitely?
You can do it indefinitely so long as it's done correctly and dosed sufficiently to achieve the intended effect and mitigate any potential side effects. As with anything in life, there's no such thing as a free lunch. Your body is going to metabolize a compound. You will have an intended effect and you will have an unintended effect. The unintended effect, when done correctly and managed correctly, is always alleviated, or at least that is the goal. Some guys don't feel great on HCG. Some experience anxiety. Some experience just an overall sense of unwellness. And some guys just say, I really don't feel a difference and I feel like I'm throwing money away. Those are the minority, but they are out there. So again, this is something you kind of go on your own with trial and error together with your provider as guidance. But I do suggest holding off unless you have immediate and essential fertility concerns in the near future, you hold off, you dial in your testosterone and your treatment, and then you start to look at adding things, because when you throw too many darts at the wall, you don't know what sticks and you don't know what to put a finger on if you're not doing well. Which one do you pull back? Which one do you change the dosing on? You make one change at a time, similar to how an allergist would have you, pull back on your diet and just introduce one thing per week until they can nail down what's wrong. Same thing here. You want to just kind of pull everything off the table, go with the most essential aspect of your treatment, which is your testosterone. And once that's dialed in, you can consider starting to add more ancillaries in. Do not go with 4 or 5 medications right out of the gate. That is a big mistake, and it's going to take you a lot longer to get dialed in over time.
Mm-hmm. Just to make this video complete, Gil, what are common doses of HCG?
So again, this is going to be somewhat patient dependent. I think a fairly safe dose for most guys who are not too strong on the primary side is going to be anywhere from 300 to 400 IUs twice per week. It is a very rapid acting water-based peptide, and you really don't need to stimulate too often. I think a once a week protocol is a little flawed because it's kind of like a spike and a crash, and then you're kind of done for the week. Twice a week gives you a decent tapering over time. I know guys that like to microdose it daily. To me, it's just unnecessary injections, even though they're sub-Q. I mean, I would save that for more of the, beneficial peptides or aminos or other things that guys like to delve into over time. Daily HCG is really not needed unless you're pre-mixing it with your testosterone, assuming you're doing that daily as well, which again, that's a whole nother video. But most of our guys are on twice a week T and twice a week HCG. 350, 400 IUs is plenty sufficient to either reverse atrophy or preserve what they have going and kind of get the job done. And we do have guys on 500 IUs. We have a handful of guys on 250, but anywhere in that range. I would say if you're under 1,000 IUs per week and you're doing it 2 to 3 times total, you should achieve this desired result. And this is, again, something to discuss with your treating provider if they kind of understand what's going on in this field.
Okay, great. Thank you so much, Gil.
My pleasure as always.
And now go watch one of these videos to learn a ton more about TRT and hormone optimization.